Aloha. Hello, everybody. Again, it is Dr. Albert Lin, the traveling doctor. This is the April 6th, 2020 COVID-19 daily update podcast. So I'm doing this live on Instagram Live and on Facebook Live, and it will be saved for your friends on the YouTube and Twitter if you want to share it later. And I'm still wearing pants. Okay, hope you guys are wearing pants too. So I'm going to try to mix this up a little bit. My podcasts have been running really long, I've noticed, and I'm going to switch it up a little bit. And I'm going to start with the news first because there's been so much news coming out. A lot of fake news, as all you guys know. I can't watch CNN or Fox News at all. I get my news from CNBC, actually, the market economy channel, and legitimate doctors. I've talked to a lot of doctors in the couple of days I've been off. So I'm still off work. It's day 24 of social distancing for me. I'm off for another 10 days. One thing I want to, before I get started with the numbers in Hawaii and US and the world, I want you to focus. Everyone's focusing on numbers, and they're focusing on the wrong numbers, I think. You guys really have to focus a little bit on the numbers. You have to look at the population adjusted new cases or population adjusted deaths, or, don't look at total cases, don't look at total deaths. People are ignoring things like amount of people recovered, and they're ignoring, the population adjusted or per capita or, per 1 million people. Those are the important numbers. And, everyone's like, oh, America has so many numbers, we're dying, everything's bad. I mean, it's bad in New York. It is 100% bad, and we'll get to that. But things are better. Again, things are overall looking better. So Marissa, hi, checking in from Connecticut, and thanks everyone who's joining. I see Daniel and a lot of other people are in here, including Mark. So thanks everybody. Again, this will be on Instagram, saved on my story, saved on my Facebook under the Traveling Doctor, and saved on YouTube and on Twitter. You can share it out later. So let me go on to the states. So basically, the states are like this. Hawaii is doing a great job. If you look at Lieutenant Josh Green's podcast, we're flattening the curve. The states that are doing the best, from what I can see, per capita or per 1 million population are Hawaii, West Virginia, Wyoming, Oregon, Kentucky, Minnesota, and Puerto Rico. Nebraska's doing the best. And the states that are doing the worst are no surprise. You've all heard them in the news. New York, New Jersey, Louisiana, which I've been talking about again for weeks. And Michigan, Connecticut, and Illinois are starting to get worse. That's for a lot of different reasons. That's partly they have big cities, partly they're close to New York and the tri-state area like Connecticut. Louisiana just messed up with Mardi Gras, and they have a sicker population. So what is clear is, and again, I didn't mention California, but California is actually doing very well. They're doing well, okay? So what I would like to tell you is that California is doing great, but they have tested the least per capita. Hawaii is doing well. And as you can see, we're getting positive news. If any of you look at your stock portfolio, the stock market shot up like 8% or something, 7% today. The reason is New York is starting to come down, or not come down, but peaking. The curve is starting to flatten for New York, and New York is the worst. Hey, what's up, Stacy? Checking in from Hawaii. And Italy and Spain, the numbers are getting better. The curve is starting to flatten. But again, everyone, that's the other thing. People are focusing on the numbers right now. Stop focusing on the numbers right now. You know what you should be looking at again? The countries that have been dealing with it 2 weeks ago. Look at the China, and South Koreas and the, Taiwans and the Hong Kongs and those places of the world. Again, especially China. China, what's up, Tay, and what's up, Danielle? Look at what is going on in China. Now, China, it's really scary, okay? I can show you some of the pictures later. I'll post them up. But they reopened, and they're doing pretty bad at social distancing now. But they've been social distancing for 3 months, so they're going cabin fever crazy. But I'll get to them later in the update. So again, I think we're getting better with our peak. We are probably not going to run out of hospital beds, or definitely not going to run out of hospital beds in Hawaii for the Hawaii people. And I think we're maybe going to we're not doing as bad with ventilator beds. So, and as you notice, even in New York, they've adjusted their numbers down. Now they're saying they only need 20,000 ventilators and everything. So Elise is right. Elise, it is coming back in China. I'll get to that in the China update. And that's what we should worry about. We shouldn't think it's over now. The numbers are promising out in New York. And again, lower states like Hawaii and whatever, and even Italy and Spain. But China, the cases are starting to peak again. I'll get to that. So Hawaii, I want to mention some broader trends. In Hawaii, we have 387 cases. I just updated it. So we had 5 deaths. Again, that's nothing if you compare it to New York, and they have what, like 10,000 or 4,500 deaths. Again, way more than 9/11. 2.8% of us have tested positive when we get the test. Not 2.8% of us, but when you do all the tests in Hawaii, and I got all this data from Lieutenant Governor Josh Green. Thank you. Welcome, Lawrence. Bomb China. That's probably not going to help. But I know Lawrence is upset about this. So we have 2.8% of all the tests we have done in Hawaii are positive. So, we're actually doing a pretty good job. So even though you think everyone is positive, it's only 2.8% of the tests are positive. We may have a lot of asymptomatic carriers, but these are where I don't like numbers. It's not that great. So we have 56 people out of those 387 people are in the hospital. And again, only 5 deaths, and maybe some people are intubated. So my point is Hawaii's curve is flattening. We're doing a really good job, but we have advantages. We are geographically isolating, are isolated. We've cut down a lot of flights, but not all of them. I know a lot of people want to ban all flights, but we've done some other good things. And I'll get into the intubations and stuff later, because we do have a few people intubated in Hawaii. And from my understanding, all the sick people in Hawaii who died, or the people who died in Hawaii, all had a lot of old people problems. So I'm not saying that they would have died anyway. I'm just saying that, that's what's going on in Hawaii. So overall, we are doing pretty well. And again, I think there was a little confusion, because if you look at the mathematical models, look at the links in my Facebook Live caption for the video, all the charts. Originally, we were thinking, oh, well, we might need to readjust our numbers. Our peak isn't coming until the end of April or early May. So now they readjusted the numbers again back to middle April again, or, so I would say middle to late April. My expectation is that they're going to extend the stay-at-home place in Hawaii until mid-May. I would guess a lot of states are still going to do that, because I think end of April is still too early to call it. Hey, what's up, Nicola? I'm going to mention Nicola because he mentioned some good stuff that I'm going to talk about today. So, here is, again, I think Hawaii is going to be one of the states least affected right now. Again, I think it's starting from the big cities, Chicago, New York's, and New Jersey, Boston, Illinois, Detroit, and then the cities that locked it down first: California, San Francisco. Gavin Newsom was one of the first governors to lock stuff down. Those are not doing so bad. California, they've really flattened their curve. So California, good job, California, and Hawaii, good job. But we had a lot of help. So again, in Hawaii, we have a 14-day mandatory quarantine. That's for all travelers. I know we want to ban all flights, but apparently that's not something that we can do unless Governor Ige asks for it for sure, and then the federal government kind of allows it too. So we've banned all open sit-down restaurants, but we can still do grocery shopping. We can still do pharmacies. And as you've seen, the lines are still ridiculous at Costco and Sam's Club and these big things. They have the senior hours and everyone's showing up early and maybe social distancing, but everyone is kind of crazy. What's up? Hi, Eric from California. So we still have stay-at-home place orders right now, but people are still able to surf. And that's been a big source of contention. I'll get to the surfing later. Because, for example, in New Zealand, my friend Danielle told me, you cannot even surf at all. You can't do any outdoor activity like that, or no driving. And you can't do takeout. You can only do in New Zealand, for example, driving to pharmacies, to groceries, no restaurant takeout, no nothing. So, Hawaii is in between. We're a little more flexible, but we're still stricter than most of the other states. I will say California is ticketing people for $400 tickets in Santa Monica to surf. That's what I've seen. So I know, so there's a lot of battle because in Hawaii, we all love to surf. We all love to hike. I'll tell you, people are asking me, is it okay to hike? I'll tell you, I think it's personally way better to swim way far away from someone and surf way far away from someone than to be hiking where people are breathing hard next to you, right? And you go to waterfalls, and all the waterfall pictures I've seen at Mount O'Willy waterfalls, all these falls, there's 20, 30 people packed together. That is not safe. I will say if you're surfing in Waikiki, where I saw a break, Queen surf break near the Duke statue in Dukes in the middle, I counted 45 people in that surf break. That's not safe, so I wouldn't go there. But I mean, it's debatable. People are surfing still. People are starting to get tickets. People are starting to get a lot more warnings. And as of last Wednesday, again, they banned inter-island travel. Hey, what's up, Mahul? Mahul from Herrick's, my old doctor friend. A lot of doctors from Herrick's and Long Island I've gotten a good update from. So I have the information from Long Island, which is getting hit hard in Nassau, Suffolk County. And my friend Mahul is, Dr. Shaw is working there. I have a lot of Dr. Shaw friends. And David who, yeah. So 11 cases in Albertson. So wow, Lisa from California saying $1,000 ticket for Manhattan. So again, Manhattan Beach, sorry, in LA. So people are not getting ticketed in Hawaii. But the rule is in Hawaii, you can walk and run and be in motion along the beach. If you do that, you're fine. You can't lie down. You can't read a book. You can't set up a towel or a lemonade stand or, sit back with a bunch of White Claws or barbecue on a beach or a park or anything. You can't do that. But if you go straight from your car to the beach and go right into the ocean and get out of the ocean and go off the beach and shower and go straight back, then that's okay, technically in Hawaii. So that's enough about surfing. But surfing is really near and dear to me. So I would say, yeah, is it a risk? Yeah, it's a risk. But I think it's way more of a risk to go get takeout. I think it's way more of a risk to go to Costco and stay in line and go to the pharmacy. I mean, think about it. Who's showing up at the pharmacies? Sick people, right? Where is probably the biggest chance of germs ever going to be outside of a hospital or pharmacy, especially if you're in the cold and flu aisle, So Marissa says that in Connecticut, they're ticketing $92 if caught in the beach, park, open space. So again, this is every state and every locale is different. Like it's very, very hard, and denser cities have different rules. So let me go. They're patrolling the beaches, ATVs. I think even the lifeguards are patrolling, but the tickets are actually coming from the cops. So Hawaiian Airlines again has canceled all their flights, but not Delta and United Airlines. So people are still flying into Hawaii, but again, it's a minority of numbers. Nicola gives a good suggestion. He says, when you shower, any public things you touch, when you touch handles, when you touch whatever, when you get gas stations, any public handles, if you do decide to go outside, you need to wash your hands and have hand sanitizer, do something. I mean, the way I do it is I do it as soon as I get back in the car and as soon as I, enter a car. Those are pretty good ideas if you have to drive somewhere. And as soon as I get back into home. So, Mehul says that things are getting better in New York. And, so again, if you go hike, if you go surf, dirty water, it'd be like brown water warnings when, there's sewage after a storm, or if there's, you have to be careful where you are surfing, where you are hiking, if it's still legal where you are, do it at your own risk. I mean, realize that if you get sick, this is something that you had on yourself, So anyway, all the airlines have not stopped. But again, there's been 95% drop of visitors to Hawaii. So I think that's pretty good. And there are more sometimes cabin crew coming in than visitors. David mentions they haven't had the stay at home order in Florida until Wednesday. So again, unfortunately, some of the southern states, Florida, Georgia, have gotten not, you've all heard about the Georgia governor and how he just found out that you can get COVID-19 from an asymptomatic patient. So let me go into more Hawaii stuff. They've been really good, promising signs. Communities are really coming together. A lot of free testing by doctors. There's been a mask share program, mask-match.com, not match.com, mask-match.com, in case you want to share PPE or get PPE. There's been a Hotel for Heroes program that's going on where hotels are donating rooms to doctors and nurses that don't want to bring it home back with them. Now, I live alone at home, but I may use this program because I don't want to contaminate my own apartment once I start working. Now, I'm in scrubs right now, but I haven't started working, and I will start working in a week. But, you know, I may work around a lot of sick COVID patients, and I know that we have some. And I know some of my other doctor friends, my friend in Long Island is taking care of 40, he's taking care of 40 patients, way more than anyone I've noticed. So I'll talk about his interesting findings later, okay? Welcome to Amy, who's coming in from, I think she's in California, Vegas right now. So that's Hawaii. Things are doing better now. Our testing is turned around quicker, 1 to 2 days. A lot of free drive-by testing. We're having free drive-by testing every weekend in Kaka'ako Waterfront Park. There's been a Dr. Scott Miskovich, who has been donating. He's paying for it out of his own pocket, not from the state. So it's a wonderful thing what some of the people are doing. We have set up arenas, Blaisdell Arena Convention Center, like New York City has set up Jacob Javits Center, and I think every major city has outlaid a convention center, and like New York and LA have the US Navy Mercy and Comfort ships to use. But I don't know if we're definitely gonna need to use the Blaisdell Arena or the convention center. So welcome to Jackie of Oahu and Mrs. King joining in. So again, that's Hawaii. It's really confusing because, we're using a lot of the different drugs you may have heard of, and I'll get into those drugs later, okay? Those drugs like hydroxychloroquine and about intubating, whatever. So the problem is as soon as you hear about one drug, you hear that it doesn't work, or then it does work again. As soon as you hear about one thing, like intubate early, then you hear maybe that's not so good, and everyone who intubates is dying. The numbers for intubation are looking pretty bad. So I'm getting a lot of protocols and from friends who work in ICUs and other doctors. But everything is technically what we call off-label. You hear this term off-label. What's off-label? Off-label is anytime you use a drug or a practice in medicine and there isn't specific guaranteed or better scientific data. But doctors do stuff off-label all the time. So it's a really confusing time because what I'm hearing from my doctor friends is the scariest thing is that how quickly you decompensate and how when you are on that ventilator, how poorly you do, how there's this big inflammatory cytokine response. So I'll break that down in layman's terms later. So again, that's about Hawaii. Hawaii generally, we're doing well. We're doing well with PPE. We're doing well with flattening the curve. We're doing well with a lot of different things. So Marissa wants to know the difference between quarantine and isolation. I'll get into that. Quarantining is different from quarantine is basically a term if you're positive. If you're COVID-19 positive, you quarantine. If you isolate, you're doing that whether you are positive or not. And that's the difference between isolating and quarantining in a nutshell. But I'll get into that. And military may have a different definition. Military does everything different. And so you heard about some of that nationally about the Navy guy, the captain, I'm sure this has gone viral, that got fired. There's different thoughts about if he did the right thing or not, but he got fired for, because a lot of Navy people were on the ship and it was starting to spread like wildfire, like 100 people were getting it or something like that. And he got fired, just like doctors are getting fired for bringing up conditions and PPE stuff. So it's a very complicated thing. Jackie asked, why is there always reports of the total number of cases and never how many have recovered? Yeah. Jackie, that's the thing. That's why I say people are focusing on the wrong numbers. People are completely focusing on the wrong numbers. You have to start looking, and in my link, my Facebook Live caption, I have a chart in the worldometers about per state, and you should look at active cases, population adjusted, and recovered cases, and active and death, population adjusted. Those are the numbers. Don't look at total cases. Total cases means nothing. Stop looking at those numbers. All they do is freak you out. So let me do a US update now. And again, I normally do this at the end of my talk, but I realized I've been rushing through the other talks and I've been talking too much about medical stuff. And so I want to give a little bit of update about the world because this is important. So US now we're up to 364,000 cases. And again, that's just numbers. And there's 11,000 deaths, and that's less than Italy still, which has 15,000, and Spain has 13,000. And we have better testing. We might have better healthcare systems. So don't focus on the numbers. Our mortality rate is 2.9% right now. Now that is going up, and that's not the 1 point whatever we want, or the 0.6% that South Korea had. But again, we're getting slammed in New York. I fully expect that 2.9% mortality rate to go down. It won't go down to like 0.1% of the flu, but I don't think it's going to be the 8% of Italy or the 4% of China when it was bad. Okay, so that's the update on the US generally. A lot of things are happening. Unemployment's really bad. You heard about people starting to get stimulus checks. I've heard some people actually get them. The people who are getting the stimulus checks first are the ones who are getting who put their bank account to their tax returns. That's how they're getting it. Stacy, I'll get into that later about the recovered group aren't getting follow-up testing. So I'll get into the testing thing later. But I agree with that. People should be tested more than once. But again, the antibody test is the most important thing. So I think it's a poor use of resources right now to test people twice, honestly, sometimes. It depends, but I'll get into that. Is it true that the CDC allows reports of just suspected cases? Jackie of Oahu asks, and not just accepted verified cases. Jackie, I don't know how they're counting it. That's the problem also with the numbers. Every state, every country is testing it a different way. Even the deaths, right? The COVID-19 deaths, are those deaths from COVID-19? Are those deaths of people who died from everything and they have COVID-19? Or are those deaths COVID-19 when they swabbed them before they did an autopsy or before they buried them? This is very complicated. So it's hard. You cannot use the same numbers per country or even per state or even like CDC compared to whatever. So it's very, 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 very hard. So anyway, again, unemployment's up. A lot of companies are furloughing. Some people are getting the stimulus checks. Some people are trying to apply for small business loans. I heard a lot of people are getting problems with that. I'm thinking way ahead, like primaries, right? Democratic primaries. Forget about that. Election day. We're going to have to figure out a system where we mail in vote early, everyone votes early, or there's a better electronic system, right? I mean, logically, if we're going to get a second bump at flu season, whatever, who wants to vote in person anymore? We don't even want to buy groceries in person anymore. So how are you going to do this, right? You have to think about this stuff for a nation. Lisa, I haven't seen that. Can you, you can, summarize for me, because I can't look at that right now while I'm podcasting, but I'll look at it later. Jackie of Oahu, COVID-19 was only human-to-human transition and reported a tiger testing positive. So Jackie, if you look at all my old podcasts, I don't trust the CDC. I don't trust the World Health Organization. I don't trust the FDA. It's not that I don't trust them. They're just reacting. They're behind the times, okay? And GK Allen's asked, do I expect the numbers to go beyond 1,000 in Hawaii? Yeah, I do. I think that we'll definitely get above 1,000 cases, but don't focus on those numbers, please. Because, focus on the deaths and focus on our mortality rate and focus on how well we are doing compared to other cities and other states, okay? Greg, yeah, there are shortages of chemical reagents needed for testing. Again, I'll answer all of this coming up after I get through my update. So New York, and it's near and dear to my heart, they're getting a lot more PPE, a lot more hydroxychloroquine. I want to say that they are getting slammed. And everyone, I know there's been viral stuff that, New York hospitals aren't getting hit that hard. It's false mainstream media, CBS News. Yeah, they put up an Italy video instead of a New York video, but doesn't mean they're not getting slammed. I know for a fact, my friends in Long Island have told me they're getting slammed. Bodies are being packed up in refrigerators. It's really bad. My friend has taken care of 40 patients in his ICU. Everyone that's been intubated has died. They've all died. They're a sicker population. They're older, they're a minority, they're obese, and the people in the rich neighborhoods like Lenox Hill Hospital, New York, are doing better. They're getting an interesting drug, which I'll mention, Actemra, right? Actemra. It's from Roche, Actemra. This is a big drug you're going to hear about, bigger than hydroxychloroquine, bigger than remdesivir. Remdesivir has the biggest data. They're doing studies all over the place, but the drug they're giving in Lenox Hill is Actemra, okay? And it is an antiretroviral again. It's $1,000 a dose. This is not cheap. It's not going to be easy to find, and you cannot easily get, okay? So I want you to know about this and know about this drug, because you are going to hear a lot about this drug later. So again, New York is doing poorly, but we're flattening the curve a little bit now. You are seeing bad cases in New Orleans, and again, like I said, it's spreading to New Jersey and Connecticut. So in New York City, we have New York State, we have 130,000 cases, 2.9% mortality. That's up from 2.6 recently. Jackie of Oahu mentions, do I think the media is creating hysteria over COVID-19 in order to push the vaccine agenda? Bill Gates owns vaccines and 20% of World Health Organization. No, Jackie, I don't think they're pushing this at all. I think the mainstream media is hysterical, but I don't think they're pushing it. The vaccine is important. The vaccine is definitely going to be important. There's a lot of conspiracies all over the place, but I won't go into that and whether this is a man-made created virus and all these other different things, because they may benefit from it. Yeah, George Soros and Bill Gates and these other people, but I don't think they created this disease, and they may be taking advantage of it on some level, but that's a different idea. Everyone's hysterical because everyone's hysterical, because people generally are focusing on the numbers and watching too much TV and not talking to doctor friends, and looking at the broader picture. So New York is doing it poorly, but they are, and the worst of all the states, but they are starting to flatten. That's the good news. That's why the stock market went up, along with Italy and Spain doing better. And again, the U.S. Mercy ship is there. I heard they were not going to take COVID-19 patients in New York City on the floating ship, but I heard they may be changing their mind on that. So keep attention from that. My original understanding was all these Jacob Javits Center and the shows and whatever is are basically overflow units for people who are doing better and cannot go home right away. Jackie Oahu, you said there are a patent on the virus. I want to see the proof on that. I want to see the links on that. And it may be a patent on a coronavirus or coronavirus. Again, this is one of those myths / rumors going around that like a doctor in New York was charged for giving a virus to China. Okay, so there's all these things going around, and I've seen some of that, and that's for a separate thing. People don't understand that coronavirus is different from COVID-19. COVID-19 is a type of virus that is coronavirus type, but so all these rumors until they're proven true. So I'm not going to address all those rumors right now. Okay. Stacy, no, originally Mercy ships were meant to be, and all these were supposed to be for the non-sick patients, because especially if you are having a floating ship where you can't get people out of that easily, it can turn into a cruise ship disaster if you put COVID positive people there, right? But they are suspecting that they may need it for New York because there's so many cases and they can't put these COVID-19 people over everywhere, So again, people are getting a lot of money to work there. They're flying up nurses from the South and from other areas and from California for all of this stuff. Jackie, again, I want to see the proof of this patent that you keep talking about in coronavirus. I'm not saying you're wrong. I'm not saying whatever, but I have to see this, and I have to see this from a legitimate source. I keep getting these questions, so I'm trying to address them. But let me get on to the rest of the U.S. So California, as I mentioned, is doing very, very well. They have a Mercy, another boat there. I think the U.S. Comfort, the U.S. Mercy. I forget which is in New York, which is in L.A. And they're also offloading patients there. I forget whether they are COVID overflow or if they are, other for other patients that are COVID negative. Again, New York, New Jersey, Connecticut, Illinois, all doing not that great. Michigan, Detroit, New Orleans, very bad. New Orleans is quickly becoming a disaster. New Orleans will be the worst place after the tri-state area. Guaranteed. I've been talking about this for weeks. World update. And again, I just want to tell you in terms of all you people that are traveling. So Jackie Wawahu does say reports of the Mercy and Comfort are being used for non-COVID victims. I've heard that too, but I am starting to hear that, it could be used for COVID-19 patients. So let's see what happens, okay? So Lisa says California has Mercy, New York has Comfort. Yeah, so let's see. Nicola, I'll get into that later about my recommendations about what I would do. But basically, I would ban all flights coming in, but it's not, it is not. And I would give tickets out to everybody in Hawaii, $100 tickets as soon as they break the rules. No warnings, $100 tickets, minimum, $200 tickets. I think you can do that, but no one's really doing that. And you need someone to enforce it. You can't do vigilantes and Batman people running around giving people tickets, narc out at everybody, So here, again, everyone wants to know when we can travel. My prediction for travel for the US, and it's different from the world. I think domestically we'll probably always be able to travel during this crisis. So internationally, I don't think we're going to be able to travel in the same way that we've thought of for a long time. I think a lot of us are going to have to wait for the IgM test. And then we're going to get a stamp on our passport or a QR code in order to travel. And that'll be screened by immigration at any other country, or even before we board the plane through TSA or other people, to know that we can travel internationally, that we have been antibodied, or we've recovered, or we've gotten the vaccine. I don't think international travel will go back, because as you see, everyone's getting their second and third peaks, right? Like everyone is starting to get their second and third peaks. So Dan Rumney, hi Dan, what's up? My old Herrick's buddy. He is confirmed New York boat, the Comfort is starting to take COVID-19 patients. So the thing is, the news changes second by second. Let's see if this is confirmed, but Dan's a pretty reliable source. Marissa, I will mention that test coming up, the immunity test. It is, yeah. So there are tests out of University of Pittsburgh or Pennsylvania, I think, or in a Pennsylvania immunity test, and Stanford has tests. All these places have tests, but they're very isolated, and they're all different. All the tests are different, Yeah. So hello to Crystal and hello to Dan checking in. So my point is, if you're a cabin fever, COVID fever American, and you want to travel, plan your domestic travel first, and realize that states like Hawaii are quarantining you, so everyone wants to come to Hawaii. I have a friend traveling on a boat, no joke, from the middle of the ocean in Central America, and he is sailing his boat for a month to come to Hawaii. That's how desperately people want to come to Hawaii. But if you're in Hawaii, they're calling you in the hotel. They call your hotel room randomly once. If you don't answer, they call you twice. And then they'll give you a ticket. That's a $5,000 ticket. So that's going to be a very expensive vacation if you all mess up. And my point is, plan your domestic travel first and realize what the rules are. Don't plan your international travel yet. I wouldn't plan international. I wouldn't even plan domestic travel until easily after this peak is coming down. I wouldn't plan domestic travel until, honestly, like the summer, until like June. That's me personally. But I also have to work with COVID-19 patients, so I'm a little different, okay? And Crystal mentions that as a DOD employee, she can't even leave the state until May 11th. So that's how, strict it is for military people in Hawaii. So here's a bit of the world update. I really want to get into this world update because it's very interesting. So we have 1.34 million cases in the world. I don't want you to focus on the numbers per se, just numbers, but in representation, US is 10% of that. Again, the Olympics have been postponed. The biggest news all of you have heard is about the UK. UK is doing pretty poorly. Their mortality rate is 8.6%, okay? That's not that great. But population adjusted, they're not as bad as the US per capita or per 1 million, okay? Jackie, again, I will mention hydroxychloroquine after the update. Okay, I know everyone's been focusing on all the drugs. I will get to those in just a bit. So Boris Johnson, I don't know if you've heard, he's the Prime Minister of England. He was sick. Now he's in the ICU. That's a very bad sign. The numbers I'm getting out of my friends are that the death rate, once you enter an ICU, mortality rate is about 50%. If you're intubated, with Boris Johnson is not intubated, he's on oxygen, but if you're intubated, The rates of survival are as low as 15% in China. In other words, 85% of people died after getting intubated in Wuhan, China. I'm hearing better results in New York, up to like 50% are being extubated or surviving to extubation if they've intubated and they're COVID-19 positive. One of my friends, again, he's had 0%. 0% of people have made it out alive. 100% of people have died in ICU. So UK, it's pretty bad. Jackie Wahoo, I have not watched that show, Fall Cabal. And Donovan Dela Cruz, welcome. Again, he's one of our representatives. Thank you for joining the show. This, again, my COVID-19 podcast. And welcome to Domi, who's checking in. So again, UK is doing not so good. Boris Johnson may be intubated. He's a world leader. It's the equivalent of Donald Trump being intubated, and he already gave up his power to the foreign secretary. You know, that's pretty impressive. He gave up power already because he's that sick. So, and if you remember, UK was one of the first countries that was trying to do herd immunity. One of my other friends, Stacy, asked about Sweden and if they were doing herd immunity. Sweden, you know, they're patting themselves on the back, but they're not actually doing very well. If you look at their case-adjusted cases by, you know, per capita, or deaths per capita, Sweden is doing worse than Finland and Norway. So, you know, they're not doing great just because they did herd immunity and are allowing people to do their daily, you know, lives and not doing those shelter-in-place acts. You know, so my point is, herd immunity has not been proven any better, you know, than this. It is not that good. So, Germany, the rates are going up as well. Mortality rate is going up from 1.3 to 1.8%. Angela Merkel, I think, is coming out of quarantine soon, so luckily she survived. She was another world leader at COVID-19. Spain has 136,000 cases, but again, they're flattening. Their mortality rate is only about 1%. It's getting better, and so is Italy. They're starting to level up, but remember, Italy got hard hit. Jackie of Oahu, you're mentioning another very common misconception and another rumor, the 5G influence on coronavirus. My thoughts are that is absolute garbage for now, unless you show me the tests and the data, okay? So anyone who thinks that 5G causes coronavirus, show me the data. I don't believe it. I don't believe it at all. This is a big, like, all these rumors that 5G causes it, that the vaccine itself later is going to cause it, that, you know, this is not as bad as the flu, which I initially thought, you know, I was wrong. This is worse than the flu. And I know because I've talked to my doctor friends who've taken care of these sick patients, and I take care of these patients. It's not about 5G. It's not about vaccines. It's not about whatever. All of that, quite honestly, is garbage unless you show me the data. This is all rumors on YouTube until you show me the data, okay? I can show you the data for the drugs. I can show you the data from legitimate articles from Lancet and New England Journal of Medicine. So let me go back to Italy. So Italy is doing better. Again, Spain and Italy are flattening our curve. Like New York's flattening the curve. So we're doing better. We're not as good as China is. I guarantee you China lied about their numbers. And I'll get to that, as I've always said every day, okay? So, yeah. So, again, Jackie, 5G, increasing respiratory distress. Show me the data. I want to see the data. I don't think it causes respiratory distress. What is the mechanism of action about how 5G causes respiratory distress? Okay, I'm keeping an open mind, but I want to see the data on this. So I don't think it causes respiratory distress. How would it cause respiratory distress? Ireland, a good study coming out of Ireland is that a prime minister there, Ireland, is going back to work as a doctor. Okay, I think that's a great thing. He's sacrificing his life. I didn't mention this, but 2 medical residents, 2 doctors in training died. Young people died fighting COVID-19. That's horrible. They didn't even become a doctor. They're probably in their 20s and 30s, and they died taking care of patients. So those are our first deaths in the US. Like Italy had 50 deaths, you know? So, yeah. Oh, okay, good. Danielle mentions Angela Merkel has tested negative for COVID and ended her quarantine. So that's a great thing. I'm happy for Angela Merkel. I wish Boris Johnson the best too. I don't agree with a lot of his stuff, but I don't want a leader of a world country to die in a place like England. Their pound like bombed after that news came out today, by the way. So interesting about other countries. I mentioned, again, Sweden is doing the herd immunity thing. They're not doing very well. Look at the numbers. They're doing worse than Norway and Finland, who are doing that. So everyone saying that Sweden's doing a great thing by letting everyone run around is not looking at the numbers I'm looking at. They're not doing it. They're doing better, but they're not doing as good. Okay, so Iceland is testing really well. They've tested like 5% of the population. It looks like 50% of the people are doing well, or 50% of the people are asymptomatic and still have COVID-19. They're doing a lot of testing. They're testing almost like 13% of the population, which doesn't sound like a lot. But it's a lot if you compare it to the U.S. and how many tests. Jackie of Oahu does mention, yeah, and this is a good point. I mentioned this in other podcasts. Does Italy have higher mortality rate because they have a highest lifespan, a majority of cases 900 years old? That's one thought. Yeah, Jackie Wahoo, that's a good point. A lot of Italians are heavy smokers and they live older. Who lives the longest in the world? Mediterranean diet, the Greeks, some Italians, and the Japanese. So, their mortality rate may be higher because they may have a lot higher population that was getting sick, and they live in multi-family generational homes. If you know any Italians, a lot of Italians live in these homes that are like 3 generations, and a lot of asymptomatic younger people may have been passing it along unknowingly to older people. So that is a bad thing. Brian says he would more cases in Hawaii than the entire country, Vietnam. Brian, you're looking at the wrong numbers again. Don't care about the absolute numbers. Look at per capita adjusted active cases and per capita adjusted deaths. Those are the numbers you got to look at. Okay, so compare that to Hawaii and then get back to me. New Zealand, I promised Danielle I would talk about New Zealand. So New Zealand, they are sort of a model to look at, okay? They are super strict quarantine rules. As I mentioned, you can't drive anywhere except for the grocery and the pharmacy and hospitals. No restaurants are open, even for takeout. No outdoor exercising or water sports, no surfing, no sailing, no whatever. And they say that's to prevent rescues and, whatever, using key emergency staff. And, all I have to say, Danielle, that's a great thing for New Zealand. It's very impractical for certain cities and certain areas, but people can practice that. It's just that people are very selfish. New Zealand has put in that role. That'd be great. New Zealand is also getting discriminated against, by the way. Australians are threatening to kick out New Zealanders back to New Zealand. And they usually love each other, And there are New Zealanders in Australia that can't get all of these economic benefits in Australia because they haven't lived there for longer than 10 years, So people have been living in Australia and working as a New Zealander, and they have a lot of cross-border workers. They can't get any of the benefits from it. So, but Australia and New Zealand are doing much better in general. New Zealand has a lot of advantage. Geographically, they're isolated. Geographically, they're very not that dense at all. They don't have major cities that have, big urban dense populations. I've been to Auckland. I've been to Wellington. I've seen them. They're not dense at all. They're less dense than Honolulu, So just to put it in perspective, So, and Stacy says, I wish we can ban cigarettes. I agree about that. Let me finish up the world update, then I'll get to the part everyone wants to hear about, which is the drugs. So Mexico only has 2,143 cases. Again, I think they've just tested very low. I'm very worried about Mexico because they haven't been doing a lot of good banning of stuff. They've banned only down to 50 people at once. Jackie mentions CDC counting the deaths from everyone who has COVID, regardless if they died from something else and COVID was not the cause. Why would they count these? Jackie, I'm not the CDC. I don't know why they do that. You're right. That would elevate the case number, but I don't know that it would, and the death number. So you have to be very careful which numbers you are looking at. A lot of these people, the point is, if you have the same morbidity and more, like you have heart failure, diabetes, end-stage kidney failure, lung disease, COPD on chronic obstructive pulmonary disease and oxygen, a lot of these people may have died anyway, but it's hard to separate out these numbers. It's a very valid point, okay? So Mexico, I am worried. I'm worried about India. I'm worried that any of these places that are densely populated, the slums and favelas of Rio de Janeiro in Brazil, the shanty towns and the townships of South Africa, Cape Town. These are places I worry about. The poorest neighborhoods in New York are dying. The sickest, the minority neighborhoods, the obese, they are dying. The rich white people in Upper East Side and Lenox Hill are surviving, and they're getting the best drugs. So big surprise, the rich people and the well-to-do people in the world are going to survive this disease more than the poor people because they have better resources, get better doctors, and get the experimental drugs first. It's not fair. I'm not saying it's fair. I'm not saying that's the way it should be, but that is how it's already showing, already right now. South Korea is not looking so great anymore. They're starting to have that uptick in trend as well. And as I mentioned, them in China are seeing that second wave. They're already hitting their second wave. So everyone that thinks that we're done, you guys are ridiculous that you think this is going to be done and over. And even the stock market's going to recover and all the jobs are going to come back, whatever. We're going to have to self-isolate and social distance for about, I will think about a year until this vaccine and antibody test comes in. Really, we really need to do that. Yeah, and Danielle brings up a good point. Closing restaurants prevents workers from spreading it on. You don't need takeout. You can just do the food yourself. I mean, that's great. But again, it is, I want everyone to cook and just go to the grocery store and Costco one time and get all your stuff, okay? And yeah, so Jackie of Oahu mentions Fall Cabal 1 to 10. I've never heard of the show. I will check it out and see. Again, I want to see the data. I want to see the studies. I don't want to watch a TV show that will give me this information. I'm a doctor and a scientist by nature. I want to see the data. I want to see the scientific articles. I don't, and again, that's partly why I'm doing this podcast, because I think I can address the drugs better than most people. And the therapies and the real numbers, the real data, okay? China, as I mentioned, a 4% mortality rate, so it's still not great. But again, I don't believe their numbers ever. I think their numbers are way higher. There's been all the data about their cell phone usage and their urns and the cremation stuff. So they're admitting that the numbers are going back up again, but I absolutely don't believe their numbers in China at all. They're reopening for tourism, by the way. Have you seen some of those pictures of the numbers and the pictures of Chinese people? Again, they've been, remember, self-quarantining for 3 months. We've only been doing it for 2. I've been doing it for a little over 3 weeks, so less than a month. They've been doing it 3 months, so they are stir crazy, and they're going out of their mind. So look up the new pictures of everyone in China going to all the hikes and the mountains and everything else. So, I'm really worried about China and the second bump coming up. So, okay, let me go back into the drugs a little bit more. And again, I can mention some of the medical garbage, but that's not, I can talk about that a little bit later, about how we're finding all the peripheral chest x-ray CT findings that everyone's dying, or a lot of people are dying once they're getting intubated. It's very scary, and that a lot of the medicine's not working. So what am I worrying about hydroxychloroquine? Well, wait, let me say a little bit more about the test first. And Jackie, you're answering a lot of questions. Thank you, but this is the last one I'll take from you. She says, what do we think we don't quarantine and isolate like this during flu season when those cases are higher? Jackie Oahu, I 100%, I don't think the reason we don't do it is because they don't hit the hospital all at once, and because we technically have a vaccine for it. We don't have any of those for COVID-19. We don't have immunity. We don't have any exposure as a society to it, and we have zero vaccine. I think if the flu is really bad, we should quarantine like that. And at the very least, we should social distance. And I've always mentioned, I think the flu numbers will be better this year, because everyone's washing their hands and socially isolating, social distancing, and people will be better about it. And people will get their vaccines for flu. And I think you absolutely should get your flu vaccine this year. So I think that is important. And welcome to Eva from, I think, Poland coming in. So, and Brian Oahu mentions, how long should we self-isolate? 1 year, work remotely? No, Brian, I've never mentioned that. I don't think you've looked at my last podcast, Brian. I know you haven't, because I've mentioned this many times before. What I think is going to happen, we'll reopen for business, just like China is starting to do. And then when the second bump hits, we'll have another social distancing program. But it will be better because we'll be ahead of the curve this time, so to speak. So we will reopen parts of the economy, and then we'll have to shut it down again. And that's where the second bump comes from, and the third bump, and the fourth bump comes from. We're going to have to do that for a year. So we won't have to stay socially distanced I know you want to get back to certain social activities. Everyone wants to go party and go to that nice restaurant and go travel and go to entertainment, Brian, and nightclubs and different things. But we're going to have to do it in Hawaii until middle May. Easy middle May, maybe end of May. I think that's just what's going to have to happen. And then when it opens up, get ready to do this again in August, and get ready to do this again in October and November for flu season. I predict, you heard it here first from the traveling doctor, 4 more peaks, 4 more peaks, 4 more bumps before we get the vaccine. This is just logical based on what I'm seeing. Maybe 3, okay? But we won't have a vaccine for a year and a half. So if we have a vaccine for a year and a half, and not everyone has immunity, again, that may be lower if we get the IgM test. Now, again, as I mentioned, the nasopharyngeal test is not very good. I'm seeing here that I may be running out of room on my Instagram Live because I'm going near an hour, but I'll restart this in case anyone are still watching on Instagram Live. So again, that nasopharyngeal test has a lot of false negative rates, and they're making new tests. I want that antibody test. And if you've heard my previous podcast, my California friend had an oral pharyngeal test. He tested COVID positive. And those idiots at the clinic didn't call him for 11 days until the follow-up call. So they forgot to call him. So lesson learned, if you ever take a test, call, follow up your test results. Because sometimes these idiots don't follow up your test, and the whole time you're COVID positive and you don't know, The oral pharyngeal test, which is the one he got where he swished and spat out, is worse than the nasopharyngeal test. So basically what I'm saying is that is a better test to get done, but even that's not good. The best one is the IgG-IgM test, the antibody test. And as you mentioned, if you listen to Trump talk, they've been a lot of those tests that have been spread out. The big one he mentioned was Abbott Laboratories. And as you know, Abbott Laboratories stock went through the roof too, but there are a lot of different companies that are going to be making these tests. So obviously when you have 100 companies making 100 different tests, what do you think is going to happen? All their false negative rates, all their sensitivities are all going to be a little different. They're not all FDA approved. Some are emergently authorized, the way that Trump emergently authorized some people to companies like Ford to make ventilators or something, some companies to make hand sanitizer and masks, So I would like to see that IgG-IgM test again done. And again, some other home tests are coming out, but I haven't heard anything great. I haven't heard a single person get a stay-at-home test and do their test at home. Not a single person in America has done that I've heard. Hi, what's up, Yvette? Welcome to the Traveling Doctor COVID-19 podcast. Again, this will be saved for everyone for 24 hours, and I'll put it permanently online on Facebook Live, on my personal page, and on YouTube. So again, the antibody test is where it's at, okay? IgG-IgM. What does that mean? Refresher course. If you test positive for IgM, you're actively infected and haven't gotten immunity. If you have IgM and IgG, you've recently been infected, but you've developed the antibodies. If you just have IgG, that means you're totally recovered and or never got exposed to the virus and just got the vaccine. And anyway, you have antibodies. A lot of people ask me about this. Well, if you test positive for it, or if you test negative for it, or even if you test IgG positive for it and you're recovered, does that mean you're no longer infected? Everyone's been asking me this question. The truth is, nobody really knows, right? Nobody knows. People in China are testing positive for a nasopharyngeal PCR test positive for COVID-19 again. So are they going to get sick again? I don't know. Are they able to get someone else sick again? I don't know. Are they fully recovered? I don't know. You sense a pattern. We don't know because there's so little about this disease that we really know. My sense is that they're probably recovered and yeah. So Yvette mentions, is it possible if we IgM positive or that you're infected but you don't get IgM? Yes. If you're very, very early days in the first, I think it's the first 2 weeks or so of the infection, I have to look up these numbers, or maybe less, maybe even a week, then you won't get it. So IgM, IgG test is not a great immediate test. The great immediate test is still the nasopharyngeal test, Also the IgM IgG test is going to be a blood draw test, so it's a lot harder to do quick turnarounds for that kind of thing. The nasopharyngeal test is still the better one for immediacy. IgM IgG I think is a better test for immunity, for like when we test if someone is immune for chickenpox, you know, when they gotten the vaccine, or the measles. And that is the test I think we need to put people back at work, to prove immunity, to travel again. Again, I think we're going to need a QR code on our phone or like a stamp on our passport that shows that we're IgG, IgM positive or IgG positive to travel internationally, to maybe even to go back to work in certain industries, right? Like that just makes sense. We need to develop this test. It is being developed. And as Maritza mentioned, there's a university in Pennsylvania has a test. Stanford University has a test. It's starting to become available, but I don't know a lot of people who've gotten it. Again, I've heard of 0 people getting this test yet. I know a lot of people got the nasopharyngeal test, but the IgG IgM test has to come out, and that's the big one. Stacy asks, when people can prove immunity to go back to work, are people going to start having coronavirus parties like 1990s chickenpox parties get infected? Stacy, maybe they are, and those people are, excuse my French, effing stupid in the same way, because I think that's just dumb. Because if you do that, all you're going to do is maybe put yourself at risk in an uncontrolled fashion, potentially, of getting it, when maybe you could have waited for the damn vaccine, right? Like, I mean, I understand the idea of like wanting to get back to work. Everyone wants to get back to work. Everyone wants to travel. Everyone wants to be IgG positive and be able to go back to work and do your thing and not worry about stuff. Even then, I'll tell you, you should still wear a mask, because why are you going to wear a mask? The mask is for what? To protect you from giving it to other people when you're asymptomatic. That is the most important thing, you know? So I think a lot of people are not, sorry, I'm adjusting my air conditioning. It's getting hot. I'm getting really riled up. Show me the money style on this. So, you know, I think it's a really bad idea to just look at the nasopharyngeal test for long-term, you know, COVID infectivity, or just look at IgG, IgM to prove, you know, whatever immunity at all, antibody immunity. But I do think the IgG test, antibody test, will be the game changer to restart our economy. And it's not going to be hydroxychloroquine. It's not going to be any of these other drugs. It will be the IgG test. Above all drugs, it's not even a drug, it's a test, will let us know who we can safely put back to work and who we need to safely isolate. Brian Oahu says he loves staying at home. So do I. Okay, so let me get past the test. Let me talk a little bit about PPE. So PPE, I mentioned the crowdsourcing sites, Match or mask-match.com. If you're donating masks or you want masks, that's a great site. You can contact hospitals directly. Some hospitals, especially New York, having much worse time than others. There's a lot of crowdsourcing sites. Be wary if you're getting new PPE. Again, what a lot of you have probably read, there's this new KN95 mask. KN95 coming out of China that people want to buy. I mean, does it work? I've heard mixed things. I think it's possibly safe. It's probably better than a surgical mask. It's probably better than a cloth mask, but do you need it? Again, the World Health Organization, CDC are all recommending, hey, Mike, welcome in from LA, are all recommending that you wear a fabric cotton mask when you go out. And again, no one really gets this. The masks are not to keep you from getting sick. I mean, a little bit, but it's more to keep you from breathing out sick stuff if you don't know you're having it. The breathing, the spitting. How many times have you guys been eating at dinner and your friend talked and he accidentally spat right in your cheek or your eye? I've done that to people accidentally. I'm sorry if you're one of my friends I did that to. Or you've been on a horrible date and someone coughed or breathed hard on you, you know? Like, this is what we're trying to prevent. So yeah, the fabric make-at-home masks are good, but as you've seen, there's certain fabrics that are better than others. Like, obviously this makes sense. The fabrics that are not as porous. Like, if you can see through your fabric, if it's a skinny, worn down like undershirt, what does that mean? It's probably more porous, so more stuff can get in, or you can breathe more stuff out. So, you know, unfortunately, if you make it thicker, that also makes it harder to breathe out of, right? So there's a fine balance, but you can make those fabric masks easier. And what am I going to wear? I am going to wear a, you know, a surgical mask when I'm really close to traveling, just a surgical, not an N95. And I'll normally wear a fabric mask outside. Okay, to all my Instagram friends, I'm about to end this here, but I'm going to restart it immediately because I have a 1 hour limit. I can't believe I'm on an hour again, but this is still quicker than last time, okay? So I'm going to end it for all my Instagram people and pick it up again. And all my Facebook Live people, you'll still be here. So, yeah. So, yeah, okay. I am back on Instagram Live. Okay. So I'm now live again. Welcome back, everyone, to Instagram. I was just talking about PPE and using fabric shirts. Neil Soriano says, how about worn out underwear? Neil, it depends. Is it your underwear? Is it some nasty chicks somewhere? Did you get out a Japanese vending machine? I don't know, dude. Like, probably new, like, thicker cotton fabric boxer briefs are probably better. I'm just saying. But I mean, use common sense. If you can't breathe out of it, it's not going to help you. It may help everyone else out, but it's not going to help you. You're going to die of suffocation. If you can breathe too easy, yeah, then it's not good either because no one's helped by that. Nobody else, you're not helped. So Lisa has been making a lot of from California. My lawyer friend is making a lot of these fabric shirts. So this is good. So blue shop towels stuffed inside were found to filter 93% of 0.3 micron particles. And that 0.3 micron is sort of the limit that they use for what will help with COVID-19. And I think even for surgical masks generally, okay? Yeah, so Brian mentions, even if you want to go back, there's a lot of jobs that are lost that are not going to come back, you know? So anyway, so again, that's about PPE. So yeah, if we could all get surgical masks, that'd be great. But as you've all noticed, those are impossible to come by. I saw one place in Hawaii selling a box of 10 for like $16 or for $1.50 each. That's ridiculous. That's normally almost how much N95s cost. And I've heard of N95s being crazy. So again, if you buy KN95s online somewhere or you get them, but again, normal people shouldn't use it. What am I going to wear? Again, I will wear, if I'm traveling in a packed area on a plane, I will probably wear a surgical mask. But just, again, more for me in case I'm sick or somewhere else, you know? If I work in a hospital as a doctor, healthcare worker, I will wear a surgical mask. I'm supposed to. If I take care of a sick COVID patient who's coughing everywhere that I'm going to put a tube in, I'll put an N95 and all my protective gear on, okay? So that's what I would do. And by the way, I ordered a really funny Bane, like a Bane mask from The Dark Knight Rises. I'm going to wear that mask when I go out, and I'm going to talk like this, like Batman, you know, all over the place. So I'm going to have some fun with this and, you know, just, you know, anyway, but that's about PPE. And again, a lot of places are still short on PPE. Nurses are striking. Doctors are getting fired. I've heard some good news that there are some states like New York passing laws now to protect doctors and nurses from malpractice, from firing, from reporting stuff. So that's a good thing. What I think will be better is that we need to save these surgical masks and the N95s and even maybe KN95s for the hospital people that do need them. When there are surgical masks available for everybody, of course, that'd be great if we can get it, like the tests. So we have to prioritize the tests for healthcare workers and people who need them. We need to prioritize the medicines for healthcare workers and people and patients who need them. We need to prioritize the, you know, drugs for all those people too. So, and that will bring me up to my next and last point, which is all the, well, last thing I want to say about that before the drugs is the World Health Organization. Hey, what's up, David Robinson and Linda are still joining in. So what I'm saying is that, you know, right now, the World Health Organization, the CDC, and the FDA are all way behind the times. They all eventually told us what? To wear masks, or at least the CDC has, you know? They all finally said that. This was common sense from the beginning. They just didn't want to tell everyone in the world you should go own a mask because they knew that people would run on the pharmacies for it, you know? That they would run out and buy all this stuff and buy it and hoard it. Like, and they were right. People are hoarding all the masks. And it's stupid. People are getting arrested for hoarding masks and selling them online for 400 times the price. You're a bad member of humanity, if you do that. So We need to save those masks again, okay? But I think the World Health Organization and CDC and FDA, they should at least be telling everyone to wear a cotton mask that way. That is important. And someone should, ideally, there's a whole industry around this right now, I think, that will develop. Making masks. Man, the mask making industry, we're never going to be short again after this at some point, I think. So that's good, But again, beware of third-party masks. Yeah, Brian Oahu, it's really sad. Someone stole $250,000 worth of PPE in, I think, a hospital. People are stealing food out of food banks. So the economy is going to get bad, guys. People are out of work and some people are stealing food. When society starts stealing food, it's food that's already being given out for free. The Hawaii Food Bank has new security people because people are, So yeah, Joe is right. They are slow to let the KN95. So again, the FDA, the World Health Organization, CDC, they're all behind the times. Do not listen to them for advice about, PPE, let's say at least, or these different things. Even the drugs, they'll be behind. It's not meant to hoard. It's not meant that you need to not listen to them at all. I'm just saying you have to keep some. I think they're very slow behind the time. This is shown. This is a test. They have failed for humanity. And it's not Donald Trump. It's not political. It's not Obama. It's not mainstream media. It's not whatever. The World Health Organization, the CDC, all these people logically failed us as, organizations have failed us. Our hospitals have failed us, okay? So you cannot blame one person for the whole thing about this. Stacy, I have not heard about that. Give me the link, and I will see about that. Personally, Stacy, I think a sauna is an awful place to be for preventing COVID-19. About sauna and heat and cold immunity. Sauna does what? It aerosolizes stuff. I think I got sick in a sauna in New Zealand that was public. I think I got pneumonia, at least, if not COVID-19, from a sauna. I wholeheartedly believe that. So I would not. I think that's garbage, personally, Stacy. Sorry. So, so let me go into stuff. Ventilators. Yeah, I want to talk about ventilators. So again, the ventilator numbers are really bad, guys. They're really bad. If you're put on a ventilator, there's a big chance you're going to die. Again, I heard anything as high as 85% of people in Wuhan, China were dying. I even heard 100% from one of my friends in Long Island who was taking care of 40 people. 40 COVID-19 positive patients in his ICU. And I heard, but if you're healthier and not so sick and don't have a lot of comorbidities and are rich and getting all the good drugs, then you're getting a 50% survival rate when you're intubated. In Lenox Hill, look up that hospital, Lenox Hill in upstate, Upper East Side, or not upstate, Upper East Side, New York City. That's a lot of rich white people that live right next to Central Park. They have a lot of money and they have really good resources and they're not overcrowded, okay? So the problem is about the ventilators. Once you get on, you're running out of ventilators. And a lot of people, one of the studies I looked at said on average, people stay on a ventilator about a week, 6 to 7 days on average. But you can stay on a ventilator up to 2 weeks or more. I know somebody or a patient I know personally, in Hawaii has been on it for 1 to 2 weeks. You're going to run out of hospital beds in some places. Hawaii, again, looks okay, but other places you are going to run out of hospital beds. Amanda, welcome from, Stacy, yeah, so saunas are public, yeah, but yeah, saunas are awful. Saunas are awful. If you have your own private sauna, maybe that might help you, but most people don't have their own private sauna. Again, this is a rich person, way to cure the disease, to say that you can go into a sauna, heat yourself up. And I mean, you talk to Finnish people and Chinese people and Japanese people and Taiwanese people, they've been going to hot saunas their whole life, naked. So I question that. I caution against going to saunas to get healed or protect you from or be protected against COVID-19 because it kills COVID-19. I don't think that's a good idea. I think that's an absolutely horrible idea. Let me be clear. I sound like Obama saying that. Let me be clear. I don't think that's a good idea. Personally, I would recommend that to 0 out of 1,000 million patients, right, until I see the evidence, okay? Jacqueline mentions, what is the difference between high network hospitals and basic hospitals? Well, Jacqueline, it has to do with your access to private doctors, your own private rooms, a number of ventilators, your access to great experimental drugs, which I'm going to get to right now. So, rich hospitals have fewer patients sharing a ventilator or even a room, and they have better, one-on-one doctors. They have one nurse to one patient, one doctor to one patient sometimes, instead of one doctor to 40 patients and one nurse to, 12 patients, or, at least 4 patients. I've heard some ICU nurses taking care of 4 patients. Normally, ICU nurse is only supposed to take care of 1 patient or 2 patients, but when they're stretched, they take care of more. A floor nurse is only supposed to take care of anywhere from 4 to 6 patients. So but that's the difference between a high net worth hospital, a rich hospital like Lenox Hill and Upper East Side, and a poor hospital like Elmhurst Hospital in Queens. So let me go on to the drugs. Everyone wants to hear about the drugs. So which drugs? Hydroxychloroquine. Hydroxychloroquine. What's the data? Guys, I hate to tell you this. Listen, I know everyone wants to believe in this drug. I do too. There is a lot of prelim evidence about it, but it is not good, okay? It is not good right now. All my friends are telling me, all the doctors that are treating it are not telling me that hydroxychloroquine makes sense. I mean, who knows? Maybe it needs to be used earlier, Marissa, ivermectin, yeah, I've heard about that just today. Marissa, this is the problem. Right now, I've heard everything is being studied for it. They're literally, you know what their drug they're studying right now? Viagra. It's not a joke. Look up nitrogen oxide, or nitrogen oxide and sildenafil, Viagra, the generic. Because a lot of people don't know, for pulmonary hypertension patients, you give patients Viagra, sildenafil, to open up the arteries in the lungs to breathe better. It dilates blood vessels, not just in your you-know-what, but in your lungs. So they are studying Viagra. They're studying ivermectin, which is a... Thanks, David is checking in. David, anybody, feel free to forward this to any of your patients or other friends, and make this, again, shareable. So welcome to Jameson checking in from Hong Kong. Amanda says New York State is giving vitamin C. So again, okay, I'll tell you every single drug that I've heard of that's being used or supplement. Vitamin C, vitamin D, ivermectin, hydroxychloroquine. I've heard of Calitra. I've heard of Acetemra. Again, that's the big one. Acetemra is the big one all the rich people are getting in Lenox Hill. And it costs $1,000 a dose. $1,000. This is some crazy expensive stuff. So it's not easy to get, is my point. Poor people do not get this drug, unfortunately. I've heard of the TB vaccine, BCG. That's the big one. BCG, I mentioned last thing, is being studied in Netherlands, in UK, in England, in Germany, and in Australia. What is BCG? Again, BCG is that little whole thing that you see on friends from countries where tuberculosis is a big deal. They get jabbed with that, and they've seen, again, the map of the world where you get BCG has very few COVID cases. That may be completely coincidental for other reasons. Hydroxychloroquine is not working out the way it's supposed to. I got to tell you, the data is not good. I haven't seen the data yet. The new data, but the old data was, again, in vitro studies out of France by the same author. He did the same study twice. He's a little biased, I'm going to say. So hydroxychloroquine is being used in a lot of protocols with azithromycin, right? So azithromycin is a Z-Pak drug, and the problem when you use hydroxychloroquine and azithromycin together is that you get QT prolongation. Your heart can flatten out and start to go in weird rhythms and even stop. So you need to give them magnesium when you give hydroxychloroquine and azithromycin. That's why we don't want to give it to everybody else, because people who are mildly sick are going to have problems getting their heart stopping and other things. Now, I don't think hydroxychloroquine has a lot of poor outcomes, generally. Like, not a lot of people get bad side effects from that. Stefan. So Stefan, again, anecdotally took hydroxychloroquine and did do well. Again, Daniel Day Kim took it and did well. Stefan's friend did well. But again, all I'm saying, Stefan, is my friends who are using it for the sickest patients, the sickest ones, meaning that they're coming into the hospital right away, they get put on it, right in the ER. They get put on hydroxychloroquine. All of them are dying. All of them are still dying. So maybe one thought is maybe hydroxychloroquine is better for less sick patients. That is a possibility. But again, we need the study. So Trump is not wrong. CNN wants you to think that Trump is completely wrong. Trump has a bad way of explaining it, but he may be right for the wrong reasons. You need the data to show it. And I don't think that everyone should get hydroxychloroquine. Definitely you don't need it as prevention. I think that's an awful idea. I mean, if you're positive and you have a mild case, should you get it? That's the $1 million question. I don't know. And a lot of people are saying hydroxychloroquine has a lot of side effects. That may be true, but most of those side effects, retinal problems, QT prolongation, a lot of these different things, they happen after weeks and months of using it, okay? So most people are not gonna use this for weeks and months. The standard course for hydroxychloroquine is 5 days. That's it, 5 days worth of the drug. Z-Pak, 5 days. So I don't know. I will tell you the best data. Jameson mentioned about zinc. Jameson, from all my past podcasts, I've mentioned zinc all the time. I love zinc. Personally, this is the one homeopathic medicine I carry every single country I've ever gone to. I used to have it right by me. I have one bag I'm not going to use because it's really hard to find. I would buy that above any other medicine that you could buy right now. Personally, I speak strongly for zinc gluconate, Cold-Ease lozenges or the generic zinc gluconate. Get that at the pharmacy if you get acetaminophen, or Hall's lozenges, menthol lozenges. Inhalers, Lisa, I don't like inhalers so much. I mean, inhalers may help if you have COPD or chronic obstructive pulmonary disease and asthma, but there's some concern. A lot of these patients in the hospital get nebulizer treatments, and those spread everything. What are nebulizers? They gas everywhere. Even inhalers, I think they help, but they're not going to help you survive the disease. They may help you breathe, especially if you have asthma. But if you have asthma or pulmonary disease or bronchitis, you probably have the inhaler already anyway. I don't think normal people should get the inhaler. Zero evidence. Show me the data. Show me the money. Otherwise, I don't think it works, okay? So, Brian, I saw the Lieutenant Josh Green stuff already. We're fine. Brian, Hawaii is going to be okay. You heard it first from the traveling doctor. Hawaii is going to be okay. We're not going to be like New York and everywhere else. We're doing really well with our curve. So I think we're fine. I don't think we're going to run out of ventilator space. I don't think we're going to run out of ventilators. I don't think we're going to run out of ICU beds, and I don't think we're going to run out of doctors and nurses, whatever. Hawaii's doing well. New York needs help, still. So my point is there's not a lot of good hydroxychloroquine and azithromycin data right now. The BCG, I talked about the TB med. The big one is that everyone is being recruited for. Even my friend Brian, who was COVID positive and now is recovering, guess what he's being recruited for? You've heard about this, plasma, right? What's plasma? Well, you may have heard IVIG. IVIG is essentially similar, at least some sorts of plasma treatments are IVIG. What is IVIG? Well, I talked about it. IG is what? The antibody, IgG. So what we're trying to do, those sick patients that have recovered, we're trying to draw their blood like a vampire, spin it down, and give it as compassionate use to who? Surprise, surprise, the sickest people, but probably more the richest, sickest people, right? Because this is not cheap to get. You're draining blood out of sick COVID positive patients that have recovered. It is not easy to get this. This is not going to be the way we cure COVID-19. The way we cure it is the vaccine. The way we treat it is social distancing and maybe some other side things and the masks and maybe early use of some medicines like hydroxychloroquine, whatever. So plasma is great. But guess what? You're not going to be able to get plasma at Walmart or Costco or Long's or even most hospitals. You're not going to ever get plasma or IVIG. Why? Because it's really hard to make. It's not like going to buy a bottle of Coke or buying some Pepto-Bismol. This is not easy to make. I haven't even seen the data out of it for IVIG. I mean, maybe it works really well, like the other drug I've heard. Again, Astemra, which is, I forget what the generic name is. I think it's something like Tazi or Tori Vanavir or something. But Astemra, which is made by Roche Pharmaceuticals, is the big one they're using in New York. It's an antiretroviral, again. So the other ones are Regeneron. The big studies are coming out about Remdesivir from Gilead and Kevzara from Regeneron. Those are the big ones they're focusing on in the US. And again, the World Health Organization, which, thankfully for them, they're doing their solidarity trial, is looking at Remdesivir from Gilead, hydroxychloroquine, azithromycin, and they're looking at favipiravir, I think, ritonavir, and ritonavir with IV. So those are the 4 data sets. But that's a long time coming, okay? So hi, Raleigh, and pretty bikini for checking in. Oh, yeah, Marissa, that's right, tocilizumab. I can't even say any of these antibody ones. Those are the ones that are really being, plasma is a big one. But again, most of society is not going to benefit from vampire-drawn plasma IVIG. I will tell you, there's a new hospital study that's coming out that I think is really interesting. And a lot of you may have seen the viral video from the emergency room doctor in New York City, who mentioned that this, doesn't look, coronavirus and COVID-19 doesn't look anything like your typical flu or even your typical ARDS. What does that mean? Acute respiratory distress syndrome. He says it looks very similar to oxygen starvation, like people turn blue. What does it look like when you're sick from COVID-19? You turn blue and your oxygen O2 sat, where they put the thing on your finger, it reads like 85%, 88%, and all the ER doctors and doctors get freaked out. We put you on oxygen, and then we're worried that you're gonna die, so we intubate you. And he says it's very weird because it looks like they're almost oxygen starved. And what does it look like? You should look up this ER doctor. It looks very similar to high altitude sickness. Now, this is a really interesting idea, and it's very anecdotal. I'm not trying to push this, but it looks very similar to high altitude sickness. If you don't know what this is, or what they call high altitude pulmonary edema, or HAPE, H-A-P-E for short, look up the movie Vertical Limit. Vertical Limit by Chris O'Donnell. It's like Die Hard on a mountain, or it's like Chris O'Donnell Cliffhanger. His sister nearly dies from this high altitude pulmonary edema. And how do they treat it? They treat it by diuresis, by using dexamethasone, which is a high dose steroid, or Decadron. And there are a lot of doctors using hydrocortisone, which is also a steroid, IV steroid. So IV steroids like IV hydrocortisone and IV dexamethasone, there may be a role for this. And the preliminary data shows that IV hydrocortisone helps some ICU patients generally. It doesn't cure them. It doesn't definitely get them off the ventilator, but it helps them. Another drug that is easily associated with high altitude pulmonary edema is this drug called Diamox, or acetazolamide. What does it do? It pees out stuff. A lot of people take Diamox when they're climbing like Mount Everest to prevent stuff. Now, I'm not saying this is the new thing, but again, I've always been ahead of the curve when telling you about all the vaccines, all the drugs, all the whatever, and that you're going to hear about BCG, that you're going to hear about Astemra, and you're going to hear about hydroxychloroquine. So I'm telling you, this is a new, interesting idea that, that COVID-19 is very similar to high altitude pulmonary edema and sickness, how people present. It's an interesting idea. I'm going to want to see the data on it more. But the x-rays, the lab findings, the physical findings, everything is very, very similar. I will caution you that a lot of the doctors I'm talking to, the ICU doctors, are saying they think most people die not from oxygen failure. They think most people die when they're intubated and then their heart flatlines. They just go bradycardic, which is slow heart rate, and then they just go asystolic. And no amount of CPR brings them back at that time. And he thinks that it's a cytokine release phenomenon and a thrombotic phenomenon. What does that mean? Cytokines are released, interleukin 6, interleukin 10. You may have heard of these things. And when the body is fighting off an infection, and they damage everything. And he is worried that's why some of these drugs may help with that. And he thinks that that's what's going on, that it's a cytokine release thing and also a thrombotic thing. So we're also treating, some people are treating with Eliquis or apixaban. That may be what you get also when you have a DVT, like a deep venous thrombosis or pulmonary embolism, or if your or a family member has a atrial fibrillation or something like that. You treat it as a blood thinner. So that is another drug. So apixaban or Eliquis or heparin or Lovenox are all being used by some ICU doctors, along with all those other fancy drugs you talked about. But again, the preliminary hydroxychloroquine data is not great yet. I want to see the World Health Organization solidarity data. I do think there may be a role earlier on use if we have enough pills for milder, completely verified COVID positive cases. I think there may be a role for it. I'm not going to say like Trump, everyone should be taking it, because I don't think everyone should be taking it. That's absolute garbage right now. Okay, so yeah, so that's basically it. A lot of stupid other things I've heard about. Again, there are people online like Jim Baker and conservative religious hosts are saying colloidal silver to prevent COVID-19. This is ridiculous. Are you like a freaking werewolf, or are you a COVID-19 patient? This is like, I don't know why people are not getting thrown in jail for all of these things. Everyone is suddenly a doctor. Everyone is suddenly a snake oil salesman. Everyone is suddenly an epidemiologist and a doctor. I went to medical school. I've studied a lot of this stuff. I've seen the patients. My other friends are too. Don't listen to the news. Do not listen to CNN, please, about some of this stuff. And do not listen to Fox News, and do not listen to Trump. So who can you listen to? I mean, do the verified stuff. Talk to your doctor friends. Talk to people like me. Get the data. Look at the legitimate scientific articles. If you have a question, I can read an article for you and tell you. Like, generally, you'll get better at reading them once you know. A good sign of a good scientific article, a lot of people, that it's been double blinded, that it's prospective, meaning they planned it instead of retrospective. These are all the signs of a good study. That's the basics, and generally that there's no observation bias, that they don't have any bias. Like, for example, the hydroxychloroquine guy, he runs, the scientist runs the magazine that he published in. The same scientist that's published both studies out of France, the 40-person study and the 80-person study. So that's my point. Yes, Alyssa, feel free to share. Anyone out there, I'm going to be slowly ending this. So this is the time. I got a couple more minutes before my Instagram dies too, because my phone's going to run out of battery. But I want to feel free to share this. It will be live, or it's live now on Instagram. It will be saved on my Facebook Live at, again, www.facebook.com/thetravelingdr. I'm at traveling_MD on Instagram, and on YouTube and Twitter, just search for The Traveling Doctor. This will be saved on YouTube as well. So feel free to forward this, share it with anyone, your healthcare professional friends even, or nurses, any of your family that want to see it. I will share it probably today. I haven't shared it to Facebook groups until I knew that this is something. But if anyone has any other questions to ask, please ask me now. Brea, hello, welcome, Brea. And Amanda said, my friend is at Cedars is working on a test with a 4-hour turnaround approved. Amanda, I've heard about a lot of other tests that have been fast tests that have been approved. Yeah, like for example, Abbott Laboratories has a pretty fast test, and I don't know if that's separate from the one test that you're talking about with Cedars. But again, that's a problem. Every hospital has their own tests, and which hospital are going to get the better tests and better drugs? I'll give you a hint. It's this. It's this. That making it rain, and the rich hospitals and the rich people will get all the best tests and all the best drugs first and all the best treatment. I don't like it, but that is the reality of the world and what's happening. Money talks, and money brings drugs and good treatments and good testing and stuff, But I do think once we get the IgG, IgM test, that is a great equalizer. That will be the blood test that puts us all back at work, lets us know who, or at least a lot of us back to work, lets us know who travels, restarts part of the economy, and even, in fact, tells us who we need to give the vaccine to and who do we need to give the drugs to. The IgG, IgM test, not the nasal test, not the oropharyngeal test. The IgG, IgM antibody test will change everything for us. I've been saying this since day one. So any other questions? Stacy, Paulina Flores, yeah, okay. Okay, so there's a shout out by Jacqueline to Paulina Flores. Yeah, guys, thank all your nurses and doctors. Please, your EMT drivers, your janitors, anyone who has to go to work in a dirty hospital, like if they need some help. I don't need help yet. I'll let you know if I do. I think I'm okay for PPE right now and even food. I'm cooking a lot. So thank you everybody for checking in with me. Stacy's question is, how confident, Stacy from Hawaii is asking, how confident am I in us getting a vaccine? Stacy, I'm very confident. The reason we don't have a coronavirus vaccine, a lot of people are like, oh, well, we're all going to die of this because we've never had a coronavirus vaccine before. Why don't we have one? The reason why we never had a coronavirus vaccine was they were never as lethal as this one was. We never had a coronavirus this lethal. And so there is not a lot of incentive to making a vaccine and testing people for a normal coronavirus, because there's not a lot of market for that. For virus like COVID-19 that's killing people, there is. So I'm convinced we will get one. And we may get it earlier. We may even get it within a year. But we are not going to get this vaccine by Christmas. This is not going to be a Black Friday special at Walmart or Best Buy. So I think we're going to get a vaccine. I'm very confident. I would be shocked if we couldn't get a vaccine eventually. But it's going to take time. It will take us a year to maybe a year and a half to get this vaccine. And Brian Oahu is right. We cannot get a vaccine or we cannot shut down the economy. And it's not just about economy, but people's jobs and livelihood and movie theaters. Oh God, I would not want to own a movie theater right now. I would not want to own a cruise ship right now. But my point is, how do we figure out who's sick? Antibody test. How do we figure out who to treat? Antibody test and a nasopharyngeal test. How do we know what medicine to use? These are all the data that's coming out now. So look out for all those experimental drugs. Again, Viagra. You're going to start hearing about Viagra, studies for Viagra, studies for BCG vaccine, studies for Astemra by Roche, studies by Remdesivir by Gilead, studies for Kevzara by Regeneron. These are the big pharmaceutical companies. Gilead, Regeneron, Roche. They're all really, really big. And again, they're IVIG and plasma. But plasma, guys, do not put a lot of hope in plasma. Just don't. Because you know how hard it is to make a vaccine? You know how when they find the one case patient 0 in an infection movie, they draw the blood out and they make 1 million vials of vaccine like that and snap of an eye? That's not real life. It doesn't work that well. And it's not that fast to make it work and make sure it's safe. And same thing IVIG and plasma. You can't just make millions of vials of plasma to give people. It is really hard. It's like stem cell transplantation. That's how I would look at it. How easy it is. It's can we give stem cells to everybody to cure coronavirus or COVID-19? No, we can't. Why? Because it's really freaking hard to get, guys. It's really hard to get. And it'll be easier than getting a bone marrow biopsy, getting plasma, but it's still hard to get. That's my point. So to Linda is a nurse in Hawaii. Fight the good fight for everybody out there. Again, if there are no more questions, I'm running on 90 minutes again. I'm always trying to run this less than an hour. I think I'm going to stick to my 2 a week again. Next time will be again on Thursday at 1 p.m. Hawaii Standard Time. I will go back and update you more if there's something that happens in between then. But this is really exhausting for me to do. So I have 3 more of these to do, or 2 more, Thursday and next Monday before I go back to work and start taking care of COVID patients. So I'll try this now too. Brian says, buy stock in Regeneron, up 75 in 1 week. Brian, I don't know about that, man. I'm telling you, anyone chasing biopharmaceutical companies, you're literally chasing a dart. You're throwing a dart right now because there's so many drugs. Again, look at Roche, look at Gilead, but there's not going to be one killer that will kill this drug, this COVID-19. It will be the vaccine. I would rather buy stock in Johnson & Johnson long-term, honestly, because they're faster and ahead of the game for a vaccine. Johnson & Johnson is predicting stage 2, phase 2 trials, I think, by the end of the year for a vaccine. but I don't know that we get it by Christmas. I honestly do not expect a vaccine by Christmas. Temper your expectations, okay? So that's it. Thanks, everybody. Again, I'm Dr. Albert Lin, the traveling doctor. And again, you can find me on Facebook, facebook.com/thetravelingdr. On Instagram, you can add me at thetraveling_MD. And again, search me for YouTube and Twitter, Traveling Doctor. All my videos will be saved there and uploaded. And I'm trying to start up the podcast and Radio Public. So that's it, okay? Mahalo, and I'm Dr. Albert Lin, the traveling doctor, saying aloha, wash your hands, social distance, and stay safe out there, everyone. Bye.